Okay, so today we're going to talk about a question that's posed pretty frequently by current and prospective patients to the clinic, and that is whether or not testosterone or TRT is associated with prostate cancer. And I think the best way to answer this question is to go through a really good review article that was published recently that looked at the associations between testosterone, TRT, and prostate cancer. And I created a short presentation about that. So let me go share my screen here. Okay, so again, this review article was published in the Aging Male, and it was titled Testosterone Therapy in Prostate Cancer. And I have a link to the PubMed hyperlink in the summary underneath this video. So if you want to review through it, in fact, I highly encourage you guys to review through it. If you have any other questions regarding the studies, I'm just going to briefly discuss the main studies the authors looked at in the article, but there are many, many more. So you can peruse through it at your leisure. Okay, so they kind of divided it into different sections. The first section is where they talked about the initial association between testosterone and prostate cancer, and it appeared to occur through this landmark study by Huggins et al. In 1942, where they looked at serum marker acid phosphatase and how it was reduced following castration of men with metastatic prostate cancer, but also increased by the administration of testosterone. So serum marker acid phosphatase was a marker that was used to look at the progression of prostate cancer. Today we use PSA, prostate-specific antigen. Back then they used serum marker acid phosphatase. And again, it appeared to decrease with castration and increase with testosterone. And there had been a couple of follow-up reports for the same group looking at clinical benefits of castration instead of administration or versus administration of testosterone in terms of growth of prostate cancer. And so this association came to play. And unfortunately, for a lot of men in the 40s and 50s, maybe even 60s, castration was considered a therapy for metastatic prostate cancer, removal of the testicles. It wasn't until the 1990s and the advent and popularity of topical testosterone as a form of therapy that other studies began to come out that maybe question this belief. There's a longitudinal study by Nishlag et al. In 2004, which did not demonstrate that testosterone concentrations were higher with patients with prostate cancer compared to patients with who did not have prostate cancer. And there had been several studies that looked at this, and the theory behind it is that prostate cancer growth seems to follow a saturation curve. And here's a good graph that illustrates that. So in other words, growth is noticed from a fairly low level. So if you go from 0 to 200 nanograms per deciliter, in terms of your testosterone levels, there is some growth in your prostate. So on the x-axis of this graph, you have serum testosterone level. On the y-axis of the graph, you have prostate growth, right? And you can see that, or PSA as a marker of prostate growth, and you can see that it kind of plateaus once you go above 200 nanograms per deciliter, right? And so the idea is within this range, 200 to 800, testosterone levels don't seem to correlate with an increase in growth of the prostate gland. Some other studies done looked at endogenous serum testosterone. So this is just testosterone produced naturally by an individual's testicles and the risk of prostate cancer. And statin in 2004 and Parson in 2005, Severi in 2006, also showed that patients with higher concentrations of total testosterone reported a reduced risk of prostate cancer in comparison to those with low concentrations of testosterone. So now it appears there may be a beneficial effect with higher levels of testosterone. Other studies looked at testosterone therapy and prostate cancer risk. So these two articles looked at randomized placebo control studies, and some of them were significant. Most of them showed an association of reduced risk. Some of them were significant, although some of them were statistically insignificant. Although the good thing is the vast majority did not show an increased risk of prostate cancer with induction of testosterone replacement therapy. So Q and all in 2014 looked at 8 trials grouped into men receiving testosterone therapy for less than 12 months and those receiving therapy between 12 and 36 months. And the results showed an insignificant reduction in risk in the first group, that was therapy under 12 months, which is good, but neither study actually showed an increase in risk. And then Boyle et al. In 2016 looked at 11 trials and reported a significant reduction of prostate cancer in patients receiving test therapy for less than 12 months. So that's a good thing. It appears that getting on therapy, improving your testosterone levels, at least according to this study, may decrease your risk of getting prostate cancer. Testosterone therapy in patients treated with prostate cancer. So there are several studies that looked at patients that already had a diagnosis of prostate cancer and they got on TRT. Kaufman et al. In 2004 showed that there was not a prostate cancer reoccurrence 6 months after radical prostatectomy was performed, with no PSA detectable post-surgery within a 24-month follow-up after TRT commenced. So in other words, these patients who had prostate cancer had their entire prostate removed, started therapy with TRT, and there did not seem to be any reoccurrence of prostate cancer cells, nor was there any PSA increases. So despite the fact that they had been on therapy for 2 years. Kara et al. Observed no significant increase in PSA levels in 57 men treated for 36 months, about 3 years, with testosterone after radical prostatectomy. Again, very promising, no increase in PSA. Again, we use this as a grading marker in terms of progression of prostate cancer, and there wasn't an increase in it, so that's good. And then Balbontin in 2014 reported that none of the 20 men with predominantly low-risk prostate cancer treated with brachytherapy experienced a recurrence of prostate cancer, with PSA levels decreasing from 0.07 to 0.01. So brachytherapy is where capsules containing radioactive substance are implanted into the prostate gland. It's one way to treat prostate cancer. And these patients were treated with it, started on TRT. They had a median follow-up time of 2.5 years of therapy, and their PSA levels actually decreased from 0.07 to 0.01 during that time period. And this is just a graphic looking, just kind of demonstrating what brachytherapy is. You can see how a needle is used to insert these capsules into the prostate gland that contain the radioactive substance and ideally cause cell death in terms of those cancer cells. And this on the left side is just an infographic demonstrating a TURP. This is not a radical prostatectomy, that's an open surgery, but a TURP is where they will go in through the urethra and resect a portion out of the prostate. Many times they use that for benign prostatic hyperplasia. Okay, testosterone therapy in men untreated for prostate cancer. So Morgan Taylor in 2011 showed no increase in prostate cancer progression events in 13 testosterone deficient men on active surveillance receiving TRT. So these men there was some concern that they had prostate cancer, right? But it was, I'm assuming it was a low grade, and they got on TRT, and it did not appear to cause any progression in the grade of their prostate cancer and severity. So another study looked at retrospective study of 82 hypogonadal men with prostate cancer treated with testosterone therapy found mildly increased PSA levels. Okay. Although no upgrade was made to higher Gleason grade on subsequent biopsies. So in this particular study, um, these individuals were treated with TRT, but they found that their prostate cancer did not increase in didn't have a higher grade, which correlates with a worse prognosis, right? So the grade did not increase at all, although there was a mild increase in the PSA. So the PSA, of course, stands for prostate specific antigen. There is some controversy as to whether or not PSA is a great indicator of the grade of prostate cancer. It's really a good indicator of prostatic mass. But regardless of whether or not it correlates with progression of prostate cancer, the increase in it was very mild. And more importantly, the Gleason grade, that's how they stage prostate cancer. Again, a worse Gleason grade has a worse prognosis. There was no upgrade in the grade for these individuals, despite them having prostate cancer and being treated with TRT. And then Ori in 2016 showed no significant difference in progression rates in prostate cancer after a 36-month follow-up period between men receiving testosterone therapy and a control testosterone deficiency group, so a group that did not receive testosterone replacement therapy. So again, both of these individuals had prostate cancer, no difference in progression between men getting TRT and those not. And then this is just a infographic kind of demonstrating the different stages. So Gleason scores kind of correlate to worse prognosis with 6 or less being well differentiated, 7 being moderately differentiated, and 8 to 10 being poorly differentiated. And going back to those prior studies, in this retrospective study, also by the Morgan Taylor group, it looked like there was no upgrade made to a higher Gleason grade, so the prognosis stayed the same. So hopefully this has been helpful. Again, if you have other questions about it, I would urge you to take a look at the article. It seems that the conclusions the authors make is that testosterone replacement therapy is fairly safe in regards to progression of prostate cancer,